welcome back to Simply Women's Health with CJ. Today we're going to talk about what I consider the cornerstone or the foundation for the reproductive system, the menstrual cycle. A lot of patients come into the GYN clinic or come to see their primary care provider because they feel as though there is a problem with their menstrual cycles. And as I like to tell most of my patients, the only way we know that we have a problem is if first we know what is actually normal. So that's what we're going to talk about today, normal menstrual cycles. In the United States, the average age for the onset of menstrual cycles is somewhere between the ages of 9 and 15. If your child has started menstruating before the age of 9 or has not started menstruating by the age of 16, those are situations that you would want to have them evaluated for. Once your child starts having menstrual cycles, the first couple of years, they're going to be irregular, they're going to be erratic while the hormone levels establish themselves. So don't look for regular cycles for the first 2 years. If after 2 years those menstrual cycles are not regulated, again, that is something that they would want to be evaluated for. So how does the menstrual cycle work? There's 3 separate phases that are involved in the menstrual cycle. The first is the follicular stage. The follicular stage is the very beginning. You have a high level of the hormone estrogen. The job of the estrogen is to build up the uterine lining called your endometrium. It's also to build an egg within your ovary. That phase lasts for a couple of weeks. After a couple of weeks, your pituitary gland will tell your ovary to ovulate. That is what's called a luteal surge. Once the luteal surge happens, the ovary releases this egg into the fallopian tubes. It also has a corpus luteum cyst, which sits outside of the ovary. The job of the corpus luteum cyst is to make progesterone should a pregnancy occur. Now, in the luteal phase, the estrogen levels fall off. So that's why some women will have irritability. They'll feel cranky because their estrogen levels are low. And for most women, estrogen is our happy hormone. So in the luteal phase, your little egg is going to be traveling on her journey down the fallopian tubes in hopes of meeting up with sperm and becoming a fertilized egg. If after 14 days the egg does not get fertilized, this corpus luteum cyst disintegrates, the progesterone level falls off, and that's what brings on your menstrual cycle. The menstrual cycle is actually your uterus cramping down and expelling all of these endometrial cells out your cervix into your vagina, and that is your menstrual cycle. It is very normal to have cycles anywhere from 25 to 38 days a month, between 25 and 38 days a month. It's normal for your cycles to last anywhere from a few days up to a week. If you are menstruating, I highly recommend that you track your cycles. Probably the easiest way to do that is with an app called Flow, F-L-O. The Flow app is wonderful, and the longer you use the Flow app, the better it gets to know you and your individual hormonal fluctuations, and it can provide a lot of very helpful information. If you have listened to this information and you feel like your menstrual cycles are not normal, strongly encourage you to make an appointment with your provider for further evaluation. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.